our very prestigious guest today who is joining us and want to enlighten us with the breast cancer awareness and give her feedback live from Dubai. Please welcome Zahra Al Darwish.
Actually, I would like to share with you one experience has happened with a person which is close to my husband, which is my sister-in-law. She's been diagnosed as a breast cancer, and in fact, what I came to know that she were diagnosed with the cancer with different part of her body, like ages ago, like maybe when she was teenage. So she was from the teenage until now, like in this journey of like how she can cure herself, and that gave her strength actually to be a strong woman and to spread the word to everyone and tell everyone about this cancer and about this disease and how to prevent it and all these things. She shared one thing with me, like when she last time she's been diagnosed as a breast cancer, her youngest daughter came to her and told her that since my birth, and I always hear that you are sick or you are diagnosed with this disease. Is this the last time I'm going to see you after you come from your treatment, or should I grave now? So she said to me that was actually very very touchy, and I told her that don't worry, I will come back to you. I will defeat this cancer, and I will come back to you and to your sisters and brothers. So that's what she did. She said, I went there and I was very strong. I tried to defeat this disease, and alhamdulillah that she came from there and she's cured. And till now I did not hear that she got anything, alhamdulillah, and inshallah I will not hear more of this information about her. That's why I would like to say for all the ladies available here that do take care of yourself. Always do a regular testing in yourself, not only for the breast cancer, for any kind of diseases, even for your vitamins or whatever. You just keep it as a always taking going through your testings and all these things, because we as a woman, we always have something behind us, someone behind us actually looking for us, either our kids or our spouse or our family. So that's why now we have this one, the October, which is Breast Cancer Month. So most of our hospitals and clinics, they have either free or discounted testing for mammograms and all these things. So I request all of you, and I advise you to go and check and do your check. Thank you very much.
Zahra, that is an amazing message you shared, and I'm sure that this is, with your live example, it's going to be very useful for the audience. So, because you are here, so I just want to get some first-hand primary knowledge from you, that what is the feeling of a family when they come to know that a particular woman is diagnosed with a breast cancer? So how much it affects the husband, the kids and the family, and if you can please share those feelings, would be very encouraging for the people who are listening, that how they can save themselves later once they come into a technical session of awareness.
Okay, see, Musa, for me, I did not gone through this experience, alhamdulillah, and I wish for my whole family just to be fine as well. But I would say about my husband, how he felt actually, because she's his sister. So he felt so bad. He felt like that, like how her children will feel after it's been diagnosed for a fourth time. And I have visited them for so many times as well, and I saw the girls. They were very like sad, and like they are not in mood even to talk or to laugh or to do anything, because they always thinking about their mother, if after the treatment she will be fine or not. Especially that she was like, what I came to know, that she was sensitive to the chemo as well. So they have to do some laser treatment, something like that. So there was the worry, there was the, the waiting time that was gonna happen. But alhamdulillah, we are Muslims, we believe in God, and we know that the death is our destiny at the end. So
it can be sometimes very stressful for the family, because families are so attached with the mother. So if something happened to the mother, it's going to destroy or damage or stress husbands, and most importantly the kids. So it's very important that what I believe is, just generally I believe that starting from the age of 10, we should take care of our daughters and our sisters, and they should have regular checkup. Screening is something that is obviously on advanced level, but with a proper doctor, if we keep doing a precautionary test, so we can see if there is a cyst or there is some other issues creating in your main main parts. So I can see that Salma, Her Excellency, want to contribute something in this conversation. Yes, please go ahead.
Yeah, thank you so much, Zahra. I'm seriously emotional when it touches our family, especially when there are kids. I know that, like in the field of the medical field, I mean, the nurses, the doctors are the most affected team, or let's say the soldiers who help the patients, not only medically but also emotionally. I would like to ask Dr. Nabila to contribute with her medical experience or life experience maybe on this. And again, I thank her for joining us here today.
Thank you, Salma. Assalamualaikum. A very good morning to everybody. Pardon me, I'm not putting on my camera because this was a very impromptu thing. Salma just put in the message and I was like, oh, I want to watch her. It's been such a long time. So I'm just going to keep the DP on. And lovely, lovely topic. You know, I'm actually very glad. October, we always see these pink ribbons and people have a lot of attention, a lot of awareness about the breast cancer, which is being put in. Now, one thing that I would really like to say, we talk about examination, but then before the examination, I mean, that is also a part of the prevention process. But then what I would really, really like to stress on, and what I really encourage my patients to do, is prevention in the right sense. So where does it all begin? I mean, everybody, we carry the precursors for the cancer cells, but there have to be factors which are actually making it, you know, switch on. The switch is being turned on by something. And what is that something? That is our lifestyle. Things in our lifestyle, things that we take so much for granted. I mean, when the first thing when we want to enjoy, what do? Oh, yes, cheers. Okay, cheers is either some kind of sugary drink, something sweet, but what are we doing? We are celebrating with poison, you know. So it is these small little things, starting with sugar, starting with the most basic things that we're eating, that is which are so much part of our lifestyle. I think if the change starts from there, then definitely, you know, that is because we are going to be starting at the root level. If we start the change there, then definitely we are going to see a change in the outcome, in the number of cases which are going to be there. And very sadly, just I think less than a week back, I had one of my patients, 65-year-old lady. She came in and she said that she was experiencing She said that, she had just a month back, she was in India, she got tested. The doctor said everything is okay, you just have to do exercises. She came to me and she's like, you know what? Somehow they just trust you for some reason. And they said, I just feel some kind of a change. So I said, okay, we'll just examine. When I examined her, I told her that, you know what? I think let's just get it checked. I wouldn't leave it just like that. And very sadly, it came out, but then it came out as the very, very initial stages of cancer. And yesterday she just traveled and she called me from there. And the things that she had to say, it is really heartwarming, very, as a doctor, to know that, you played your role in the early diagnosis. I feel as a doctor, yes, that is our part, but I also feel that paying a lot of attention to the triggers, to our lifestyle, that also I feel is a big part of doctors' responsibility. So, I mean, I'm trying to do my bit there, but yeah, this is what I wanted to say, that I think lifestyle, we have to concentrate on what we are doing there, where we are going wrong.
Absolutely. I totally agree. I mean, see, like I have actually, my father is a breast cancer patient, more than 30 years. Very cautious on this this regard. So if I have pain or I had once pain and he rushed to the hospital and had me just immediately. At that time, maybe I was like 15, 16. He's very, very
cautious,
sensitive. Yeah, sensitive, cautious, and very quick on this point, at least.
That's good. So Dr. Nabila is with us. Maybe we can get this opportunity to ask from her that what are the early symptoms that a girl or a woman or a man has to know if they have these feelings, so immediately they should rush for a screening. I'm quite sure that those people who have a healthy lifestyle, because in UAE we are all active and we have gyms, we have leisure activities, we go treadmill, we do take care of our diets. But along with that, if there is symptoms, so how can we get it? What are those symptoms?
Thank you so much for the question. I'm so happy to be here actually and talking, because I just love talking, and medical stuff, amazing. So regarding the symptoms, every woman would know the shape of her breast, and there is always a little bit of a difference between the two. So one important thing is knowing what is your normal. So if you notice when you're standing in front of the mirror, that there seems to be any change, and something that you would just feel like, no, something is not right, get it checked. So then we talk about lumps, that a few people might be able to feel it. Many times what happens is only when it reaches a particular size, that is when somebody is able to feel it. Sometimes just the feeling of breast heaviness. There might be skin changes. There might be some kind of redness. There might be some kind of fissuring or dimpling. The nipples could sometimes crack. There might be a discharge from the nipple. So any discharge from the nipple other than milk from a lactating woman is abnormal, and that needs to be checked. Any kind of redness, any kind of symptom or any kind of change in the breast which is not explainable, that has to be checked.
Absolutely.
Yeah, that's very useful, I guess. That's very useful. And this is, what about the males? This was mostly for me, female. So what about the males? How they need to take care of themselves?
Actually, one thing, I'm so glad actually Salma brought it up. When we talk about breast cancer, it's always pink and it's always the women that they talk about. Male breast cancer is just 1% of the population, but still, for the person for whom it has happened, it doesn't matter whether it is one. For him, it has become 100%. So even for the males, the symptoms are going to be the same. You're going to look for, if you feel there is any change from the normal. And one thing which is very, very particularly important is the family history. So yes, being aware about your body, being aware about any change in your body is important. But then at the same time, the fact that somebody has a family history, then it is also a time to be cautious. I know somebody very, very close, and he was diagnosed with Ewing sarcoma. And you will not believe, he was diagnosed with it only because one day he complained that, he was having pain in the arm, and then there was a big swelling there, and it just looked like probably it was traumatic. Maybe there was a blood collection or something had happened. But then when they examined, they said that it looked like something suspicious, and it turned out to be Ewing sarcoma. Now the thing is, it was a 10 centimeter mass. 10 centimeters is quite big, which means that the boy was not aware about what is happening in the body. And it was something which was right outside on the arm. So it is important that we are aware about our body. Sometimes a very important thing is we might feel something, but we have this habit, I think the general public, that, oh, you know what, it is nothing. I don't think it's going to be anything bad. Because the perception is that, you know what, this cannot happen to me. The question is why it cannot happen to you. You're a human, right? So we have to be, we have to have a very open mind towards it, that yes, anything could happen to anybody. So once that awareness is there, that, be cautious, be on the lookout, then I think that is important. Once you stop disregarding symptoms, or you disregard a thought, I think that is something that should be avoided in the public. And that is why awareness is important. And that is one thing, when we talk about breast cancer, it is always they talk about women. But I think the men also have to be equally aware that, there is also 1%. I'm not really sure how many people really know about the 1% of the breast cancer in the male.
As we are spreading awareness as a male, I can say that 99% men only think that the breast cancer is for female. So they don't know about this concept. And I think these kind of talks is very useful and effective, that will create some awareness. So men will also start taking care of themselves, and obviously they will give a due care to the women they are around with. If it is a daughter or a wife or a mother, they will go regular screening and will keep looking the symptoms that you just told, because these symptoms can help in advance to diagnose something which is coming to you as a stage 1 or stage 2, or maybe if you don't care, then you are on the last stages. That's not a good preventive measures.
Absolutely. Once I had a patient and I was talking about the breast cancer because somehow the topic came up. And then I mentioned about male breast cancer, and he's like, really? Males also have breast cancer? I said, do you have a breast? And he's like, yeah. So I said, then come on, simple.
Yeah, you're right, Dr. Nabila. These kind of informative sessions really create change, and your contribution to it is really important. And also I want to ask, because we have different kind of screenings and for different kind of cancer. So breast is one of them. So what should be an approach of an individual, whether it's a male or a female, in general in life, that what they should do and what should they don't do in order to prevent themselves from any unhealthy conditions?
So one thing I told you, because along with being a medical doctor, I'm also somebody who's into energy healing. One thing that I've learned over the years is that the body talks to us, but then are we really listening? So a symptom that you are actually experiencing, on your body, it's actually the body trying to tell you something. For example, I'll give you the example of a patient I had. He was coming to me with back pain. He came once, okay, I gave him the symptomatic medicines. He came again, and again I gave him the medicine. But the thing is, somehow I just felt like, what, is this all that I can do for him? What is happening? How can I really help him? And then I realized that, I had learned in theta healing that whatever symptom is coming up, it is the sign of something your body's trying to tell you. So then I realized, when he came to me next time, then I said, okay, fine, tell me about your back pain. Okay, so he told me, but then what I realized is, a person who's having recurrent low back pain means he's feeling financially unsupported. That is where the problem is. And the body is presenting the symptom as a lower back pain. So then when I got into that, and then he realized, how did you know? And I was like, no, just tell me. So I started talking to him. So now the question is, okay, I have come to know low back pain. This is the financially unsupported, what I can do for him. So now the advantage is that I'm also a certified life coach. So then I sat down with him And then I talked to him, and we thought of ways that, how probably he can move away from that. Now, that I understand is not a part of my duty as a regular doctor. But the thing is, I have this very strong viewpoint that I don't consider a person as, what, you're a diabetic, you're a hypertensive. No, these are tags which are given by the medical professionals. For me, you are everything. As in, your nutrition is important to me, your emotional state is important to me, your physical activity is important to me, your sleep is important to me, because that is what makes you as a person. And that is where we have to begin. So the symptoms that you see, for example, I would target it as a whole. One thing that is very, very common, and cancer also is included in that, chronic inflammation. Chronic inflammation is something, 80% of the diseases of today, they have their foundation as chronic inflammation. So, for example, you say stroke, you say asthma, you say anything to do with the gut. Generally when we talk about inflammation, there's a whole lot of thing going on about gut health. But actually, even for diseases like cancers, chronic inflammation is the basis. So if we are able to target the cause, what is causing the chronic inflammation, then I think we will be able to move towards a better health, a better society. So diagnosing and screening is great, amazing. I like it. Okay. But you also have to see that, the cost, it bears on the healthcare system. So how about decreasing the disease incidence? How about, a world where we actually truly, health is a privilege. Health is a right to every individual and not a privilege. Not everybody can really afford treatments. I know people, who have lost their lives because they don't have all the money that goes in the treatment. I mean, we are really fortunate that in the UAE, there are places, where the government supports people who are not able to afford this kind of treatment. But there are many other countries, where these privileges are not there. So how about we do things in our life, where we're able to change the basic foundation at the grassroots level. So, I think things would start from there. Spondylitis, diabetes, cholesterol, all these, I think 80% when I say, so I think we cover a big chunk of the problems that we talk about, something that we think like, I just have a little bit of diabetes, just a little bit of cholesterol, doesn't matter. No, but the point is, why are you accepting it? There is a problem there. Your body is talking to you. There is a meaning there. So sort it.
Yeah, this is very important and very interesting approach that we need to ask from our body, and we have to understand the symptoms, then we have to try to reverse them with our healthy activities or maybe with our food. Because we live in a country where the healthcare is the best, and government is also spending a lot of money for awareness, and we have so many hospitals who are actually doing a free breast screening since years. So on this month, you will see all the hospitals, they are giving you a free screening, and based on your screening results, you can consult with the doctor and take the things on further.
Thank you so much, Dr. Nabila, for your input.